Hi, everyone. My name's Arya,
And I'm Josiah.
and we're both medical students at the University of Maryland School of Medicine. So, Josiah and I are both actually interested in radiology, and we both have an interest in animations. It's something we bonded over when we first met each other in med school. So, today we're going to talk to you all about basics of chest X-rays, and we're hoping to connect that, love of animation with our interest in radiology, and hopefully make a fun educational video for everybody. So, let's dive right into it. All right. So I'm sure everyone's, kind of heard about X-rays. It's pretty, out there. But, just to get to the basics of X-rays and like the simple physics of it is that an X-ray is just a form of electromagnetic radiation. It's the kind of radiation you use for patients. And the way you typically get the images with them is you'll have a patient and then you'll have a generator of that electromagnetic radiation, and you'll have something typically behind the patient that will kind of absorb those beams of radiation. And different kinds of tissue absorb radiation in different ways. Bones absorb it the most, so that's why they appear the brightest. Whereas other things, such as like air or skin or fat, don't absorb it as much, so it doesn't come out as bright as bone would. So this helps kind of delineate structures when you look at an X-ray to see what is what. All right. So the kind of a common approach to chest X-rays is something we call the ABCD of chest X-rays. So what we have here is a normal one, and we'll go through this step by step together. First thing is A for airways. So the main thing you kind of want to look for when looking at the airways is the trachea, which is this structure right here. And you notice how it's a little darker? That's because there's air in the trachea. So this kind of goes back to where we talked about how like air will absorb that radiation less. That's why it's kind of darker. And so the big thing when you want to look at the trachea is whether it's midline. And this one looks like it is. And that's important because certain pathologies will kind of push the trachea to one side or the other. Next thing you want to look at is B for breathing. So this is typically the lungs. So the big thing for the lungs, which is on both sides right here, kind of where it's darker, again, full of air, so it appears darker, is you want to look at these scattered white things on both sides. These are called the interstitial markings. You typically want to see them roughly equal on each side as well for a healthy patient. Another thing you want to look at is like the vascular markings of the lungs, which are these guys right here, kind of on the sides. You want to make sure these aren't too full either when you're looking at a chest X-ray. Another thing is the pleura, which is kind of like the borders of the lungs, which would kind of be on the edges here and here. You wouldn't really see it here because this is a healthy patient, so the lungs are fully expanded. So when you typically see the pleura, it'll clearly define that's usually a pathology that you want to be careful for. The next thing you want to look at is C for circulation. So what's the thing that pumps blood all throughout the body? It's this guy right here, the heart. The big thing you want to look at for the heart on chest X-rays is the size. You want to look at something called the cardiothoracic ratio. It's kind of defined as like you want to make sure the heart is less than half the entire thoracic area, which is this whole thing over here. So in a healthy chest X-ray, you want to make sure this guy is less than half of the total area right here. Next thing you want to look at the diaphragm, which is these structures down here. The big thing with the diaphragm is you want to make sure that they're not blended. You don't want it to kind of be like a straight kind of line, straight border right over here. You want to see that angle kind of go down all the way, which you do see on both sides. But you don't want the angle to be too steep down here as well, however. So you want to be careful for that because this angle is too steep. That kind of also signifies some disease processes. The other thing you want to make sure with the diaphragms is that there's no other air kind of like underneath them. That can be indicative of other like emergency disease processes. This air pocket right here is just the gastric bubble, which is kind of normal on chest X-rays. And E, I know for everything else. I know this is all a lot, and but this is the last part, and gets a lot in there. But the first thing is kind of you want to look for everything else is kind of foreign bodies. So you know how patients or a kid might swallow like toys or anything like that. Sometimes you'll get a chest X-ray to look if there's any foreign bodies that have been like aspirated. The other thing you want to look for on kind of everything else is the ribs, which are these guys over here on both sides. And one thing I want to quickly go over before we move on for the chest X-rays is just to orient ourselves. I know, you see the left here, but that's on your right-hand side, right? A little confusing. But you want to consider when you're looking at chest X-rays is you're looking at it from as if you were the view of the patient. So this side right here is going to be the right side of the patient, even though it's your left. And this side is going to be the left side of the patient, even though it feels like it's the right. So that's just something to orient us. When looking at any kind of really radiographic imaging, this side is the left side, this side is the right side. All right, let's go ahead and get to our first case and kind of connect it to our favorite show that Josiah and I bond over all the time, which is Regular Show. All right, so one of the characters, Muscle Man, is kind of sitting with his friend, High Five Ghost, outside on a nice sunny day. They're kind of cracking jokes, just being bros, when all of a sudden something really terrible happens, and he's coming to the emergency room in pain. And I don't know, Josiah, if a bear falls on me, I'm pretty sure I'd be in pain too. What do you think?
I'd be in a lot of pain and I'd want some imaging.
Yeah, I think that's appropriate to get some imaging. All right, so this is his X-ray right over here. If you want to go ahead, take a minute and take a crack at it and see what's going on, go ahead. But other than that, we'll go through it together. All right. So remember our ABCDEs. All right. First thing is A, airway, which is the trachea right here. Looks midline to me, looking good. B, breathing. You see the lungs. I don't see a clearly defined pleural border. That's all good stuff. The interstitial markings, which are these scatter stuff, also kind of look good, roughly equal. The pulmonary vasculature also is looking good, not too full or congested. So those all look good to me. Circulation, the heart. The heart doesn't look too big, less than 50%, which is all good things. And D, the diaphragm. You see the angles. They don't look blunted. No really any like signs of emergency or free air really underneath them, which is all good as well too. And for everything else, foreign bodies, I don't really see any foreign bodies. Looks like Muscle Man didn't eat anything weird right before this happened. But for the ribs, can you spot something weird going on? Yeah, it's this right here. This looks fishy. What do y'all think this is? Let's get into it. Just to summarize, our airways were looking good. Our lungs were looking good. The heart is looking okay. It's a good size. Nothing going wrong with the diaphragms. But the everything else, the ribs, that looks a bit fishy. Let's get into it.
Aria, we just got a call from Muscle Man's brother, Muscle Bro, and he's really worried. They want an update and a diagnosis fast.
Yeah, he doesn't look happy. So let's get on this quickly. All right. So this is what we call a rib fracture, which is, I think in this setting makes kind of sense for Muscle Man. So the most common causes of a rib fracture is just blunt trauma, which I feel like if a bear falls on you, I think I would call that blunt trauma, to be honest with you. But anyway, in the real world, outside of the animation world, one of the most common causes are like motor vehicle accidents. That's a big one. The other one is falls, especially in the older patients of osteoporosis and all that. It makes it easier to fracture these ribs. And direct blows to the chest, as we saw with the bear falling on Muscle Man. And some of the symptoms that you'll have patients kind of present with is like that chest pain, shallow breathing, and kind of point tenderness. So when you do a physical exam, you often be able to kind of feel that like fractured rib when you're palpating with your fingers. And also, a big thing when managing these rib fractures is mostly conservative, usually just pain management, because you want to make sure those patients are able to breathe and expand their lungs despite the pain.
All right, let's get into case number 2. So after a long day at work, Mordecai and Rigby decide to take a break and grab their favorite slushies. But suddenly, Mordecai gets a very sharp pain in his chest, and he starts getting really short of breath. We get some chest X-ray imaging immediately. So again, feel free to pause this video and try and see if you have an idea of what's going on, and then we'll go through it systematically. So to start, our airway, as we see, the trachea, it looks midline right here. It's patent, it's full with air, and it's not deviated to one side or the other. For our B, our breathing, so we have some interstitial markings are present, and I see some of those vasculature present on the left side, but something looks a little strange on the right side of the chest, and we can talk more about that. Circulation, so our heart looks in the right spot, that cardiothoracic ratio, it appears to be about 50% of that, and so everything looks good. For the diaphragm, it appears that the diaphragm doesn't have any blunting on either side, but it looks like it could be a little deep on the right side. So let's recap. For our airway, it looks like that's okay, but breathing looks like there's something strange going on the right side. Our circulation, we said that looked good, but we did notice a little bit of an abnormality on the right side of the diaphragm. Everything else, it seemed like there was no foreign bodies and the bones had no obvious fractures to us. So let's see what's going on.
Oh, Josiah Benson, the boss just called. He said if we don't get Mordecai back to work soon, we're getting fired.
Okay, let's get a diagnosis immediately. So the diagnosis was a spontaneous pneumothorax. And what is that? That's just a spontaneous lung collapse. And that is a common condition in tall, thin people. So similar to Mordecai. What can cause this? It can be caused by increased vertical stress in the lungs, subpleural blebs, which are these pouchings in the lungs. And the typical X-ray findings will be you'll have absent interstitial markings. So on the right side, we don't see any of those interstitial markings like we do on the left side because this lung cavity is filled only with air. You'll also see a visible pleura. So as we discussed before, the pleura should be on the edge of the lungs and you shouldn't really be able to see it at all. Like you can't on the left side, but on the right, you can completely see the edges of the lung because it's collapsed. You'll also see what's known as a deep sulcus sign. So that was that abnormality we were talking about on the right side of the diaphragm. And it just means an excessive deepening of the costophrenic angle. And that usually tells us that it's a pneumothorax as well. Again, this is a normal chest X-ray, and we see those interstitial markings are present on both sides. And then we also see the lung vasculature, and we can't see any visible pleura. Let's go into case 3. So Pops comes into our office, and he has a temperature of 101.4. He's not looking great, and he complains of a very bad cough that has lasted for more than a week.
He's not looking too good, Josiah. Dr. Mailer, Mr. Mailer just called, and he really wants us to get on helping him fast. He's kind of upset how we let this happen.
Okay, I know Mr. Maylard is very protective of Pops, so we should get some imaging right now. Okay, so we get this chest X-ray, and again, take a minute and see if you can see what's going on. So again, our airway, it's a little hard to see in this one, but if you look closely, you can tell that the airway is patent, the trachea is midline, and it's not deviated. Our breathing, so we can see interstitial markings, we can see the lung vasculature, but there's an obvious abnormality in this top right side. So our circulation, our heart appears to be in the right space, that cardiothoracic ratio appears to be less than 50%. From the diaphragm, what we can see in this image, it doesn't appear to be blunted, and there doesn't seem to be any excessive narrowing of that costophrenic angle. Everything else also appears to be fine. So for our airway, that looked good. Our breathing, we had an abnormality in this top right area. Circulation, that appeared to be okay. Our diaphragm, that seemed fine. And then everything else, again, no obvious foreign bodies and no obvious rib fractures from our perspective. So what do you think is going on? Well, the diagnosis was a bacterial or a lobar pneumonia.
How did this get on the part, Josiah?
I have no idea, but I think we might need to set up a quarantine.
Oh boy.
So this is an infection of the lung parenchyma, and it commonly occurs after an upper respiratory infection, maybe one that wasn't fully cleared out. So when you hear things of someone who had a cough, signs of some sort of upper respiratory infection that got worse instead of better, then you might be thinking of a case of bacterial pneumonia. The symptoms are exactly how Pops presented. They'll have a fever, they'll typically have chest pain, and a productive cough, which just means you're spitting stuff up. Typical X-ray findings, you'll see that lobar consolidation, and that's just a fancy word for this white patch that we see up here. You'll also have these findings, or this consolidation will be unilateral as opposed to bilateral. Different types of pneumonia, like viral pneumonia, will have some interstitial markings that are on both sides. You also won't see any lung volume loss like atelectasis or pneumothorax. So again, this is a healthy lung, and as we see, there's patent lung cavities on both sides, and there's no obvious consolidation. So Pops looks like he's in pretty rough shape, and we would want to start him on some antibiotics pretty quickly.
Sounds like a plan, Josiah. Yeah, yeah. A lot of problems going around the park recently. I don't know what's going on. Sounds like a string of bad luck.
Yeah, it's not looking good for them.
No. But anyway, everyone, I hope you enjoyed the video. Just to summarize, we kind of talked briefly about the physics of chest X-rays, kind of went for the ABCDE approach. and kind of gave a few examples of cases such as a pneumothorax, a pneumonia, and a rib fracture, and kind of we just went over some of the basics of those. So really hope you enjoyed it and found it educational, and let us know if you want more. These are just some of the references we used. All right. I hope you all take care, and I'll see you next time.